Hi, I'm Dr. Jessie with Care for Moms, Care for Kids, and Pelvic Floor for Moms, talking all things niching down as it relates to finding the perfect patient, the perfect community of patients in the way that you want to practice, more than likely in a smaller clinical setting. My expertise is chiropractic, but this can relate to many different professions. It does not have to be chiropractic. It just would relate more to a profession building out their practice, or a professional building out their practice in a smaller clinical setting. In our setting, we have, at the time, because it's always fluctuating with doctors having babies and things shifting in life, but it's like 5 doctors and 5 front office staff. So we operate with 10 people in 1,100 square feet. So it's not a big clinic. We use every inch of it, but that might give you a reference for what I'm talking about. It did start with just me. So as we walk through this, I will definitely be talking a little more about that growth into figuring out who our people are, who our community is, especially with a smaller clinic, and especially when you're starting out on your own and then wanting to build something from the foundation up so that you have a team, so that you have backup for backup. But the way I started, and this stems really from my relationship with my husband, he's in the world of advertising and marketing. So I've lived it for a very, very long time, learning a lot about marketing and how you really communicate and reach the people who you want to reach. The biggest thing is finding out who you relate most to, or who you want pulling in the door. So it doesn't have to be somebody that is just like you. In my case, it was because building this clinic was stemming from my own beautiful frustrations as a mother with 2 young kids. But it might have been stemming from my relationship with my mother, who deals with needing care as a woman in her 70s, or strictly infants, because of experiences I'd had dealing with babies on a different level in a different clinic, or whatever my experience was. It doesn't have to be exactly the person that you are, but in my case, it was. I knew that when we started the clinic, I wanted to cater to women who had younger children, who were in the trenches, who were really, really, really working hard to show up every day, and it didn't always work the way they planned. When I built this clinic, it was based around finding that one person who was the epitome of who I wanted to reach. That, in my mind, was a 31-year-old mother with a 3-year-old and a 1-year-old who really, quite frankly, didn't have a ton of money at the time, because let's be honest, when you're having young kids, it's not the time in your life typically where you have money just flowing in. And in our case, when I was with my kids at that age, we were making a lot of financial sacrifices to have the time to, be building a family. And it was just really tough. And so when I went somewhere and spent the money that we had, I had to get results, and I couldn't be going all the time. That goes into, not having the support to bring your kids anywhere and everywhere. So that was also a piece of it. When I'm thinking about the perfect patient for me was the patient who didn't have just ample amounts of kid care available, who didn't have just a ton of money to spend on everything all the time, who was pretty busy and dealing with things that were unexpected every single day in regard to parenthood. So when I started the clinic, that was my person. It was the person who was doing everything to just really keep up, to spend time with their kids, to make sure they were prioritizing all the right stuff while still trying to prioritize themselves, which, let's be honest, can be really difficult when you are in that realm. It's very, very busy. It's a lot. And again, it's a lot of unplanned everything. You wake up in the morning, you don't really know what you're going to get. And that was who I was essentially wanting to reach when I started the clinic. It obviously has evolved from there, but as we got going, it was so interesting. On social media, it actually started telling us who was paying attention. And for us, in building the clinic around that one persona, that person that I envisioned needing help, it kind of built itself around that, and the algorithm started telling us who was paying attention. And that for us was women ages 25 to 40. Very exclusively. It has not changed in the 5 years since we started the clinic. It's 25 to 40. Of course, we have women who are older than that, and we have women who are younger than that. But in general, based on, all of the analytics, that's our age range. And so the number one thing was finding who is that patient that we want to reach. Once we started speaking to that person, then the analytics started telling us who was actually paying attention to that. And from there, we expanded based on what the community was telling us and what, we were wanting to reach. I will say, when you have the perfect patients walking through the door, and I know the difference because I've been doing this for a long, long time, the difference between a person walking through the door who is the perfect patient and a person walking through the door who probably isn't a great fit means the difference between having the energy and the outcome that you want versus not. And so you can see how over time that is a very important thing to pay attention to, because if the more energy and the better outcomes you have, the happier your community is going to be as well, and the happier you are going to be. So it really is that important to hone in on the type of person you want to reach and continue to do that every single day. Try not to steer away from it, and try not to be fearful of the fact that it's just one tiny category in the world of people that you can help. In a lot of professions, we're told that we can treat a lot of different things for a lot of different people. But the problem is when you don't focus in to help, a very small group of people and become the best at it, you don't get to help as much as when you do get very specific with the people you want to reach. And no, it's not going to be patients flowing in super quickly right off the bat. Typically, it takes a long time to build that, and for people to know that that's what you are reaching for, that those are the people you're reaching for. But it's worth it. When you get there, it is worth it. It makes all the difference in how you get to feel every day, in how you re-energize, and just even in your passion for it. Because again, if you're trying to reach one specific type of group of people, you're really typically very passionate about it. And if it's something that, ignites your heart and your passions deep down, that, comes out in everything that you do in your work. So, keeping it really simple in today's talk, but really, focusing in on who that one person is that you want to reach. And I would write it down on paper. I would look at it, and then I would literally give yourself 6 months to a year just focusing on that one person and see what happens. See what happens to the algorithm. See what happens to your analytics. See what happens to the people walking in the door. You will probably be so pleasantly surprised by what you are changing for yourself and for your community by doing just that one little thing.